Hi, my name is Renee Heent, United States University. I will be recording this video and uploading it to YouTube in an unlisted manner. It will be viewed by my faculty, my professor, and myself. Do you give your consent?
I consent.
Okay, great. Okay, we're going to first start out by assessing your head and looking at your hair, your texture, which looks good. Then looking at the shape of your head, looking for any rashes or lesions, which are not present. Everything looks normal. Then I'm going to be looking for palpating your head for any hematomas or depressions, which there are none. Can you take off your glasses? Okay. Then I'm going to be moving down to your eyes. Your eyes, I'm looking at your eyelids, looking for exophthalmos, which is bulging of the eyes, and ptosis, which is drooping of the eyes. I'm going to gently look at your conjunctiva and your lacrimal system, and looking at your sclera, cornea, and your iris, which all look good. Next, we're going to test pupillary reaction. I'm looking for direct and consensual, so I'm going to... Okay, both direct and consensual pupillary reaction is present in both eyes. Now we're going to test your extraocular eye movements, okay? So you're going to follow my finger. Don't move your head. Okay, great. No nystagmus present, and we're going to follow my pen line. We're going to test for accommodation and convergence. Okay, great. Both accommodation and convergence present. Then we're going to be doing a visual fields test with my, we're going to do a Snellen chart first. So please tell me which one.
Can I put my glasses on?
Yes. LTFPH. Okay, is that the slowest? Is that the lowest one you can do?
Yeah.
Okay, great. Now I'm going to be doing assessing your peripheral vision by confrontation. Okay, so you let me know when you can see my fingers, okay?
Yeah, I can see your fingers.
Okay, and then I'm going to do this side.
I can see your fingers.
Okay.
I can see your fingers.
Okay, good. Now I'm going to use my ophthalmoscope. Okay, now take off your glasses again. Okay. I'm going to be doing each eye individually, okay? And I'm doing right eye to right eye. Okay, ready? Okay, I'm looking at the optic disc in the cup and the associated blood vessels. Everything looks good. I'm looking for the red eye reflex as well, which is present in the optic disc in the cup, and the associated blood vessels are both present, and so is the red light reflex in the other eye, and your iris and your lens look good. Okay, and then we're going to go move on to your nose. I'm going to just palpate your nose. Can you take off your glasses again? Sorry, but palpate your nose, okay? And then your frontal sinuses and your maxillary sinuses. Do you have any pain?
No.
Okay. I'm going to close one nostril. I want you to breathe. Good job. And then, okay, good. And then I want you to be able to smell this. What is it?
Vanilla.
Okay.
Vanilla.
Okay, good. Okay, and then we're going to move on to your ears. So I need to stretch this out. One thing I forgot to do is a visual inspection of your nares, okay? None of your thing. Okay. I'm just looking nice and pink. Okay. Okay, so the next is your ears, and then we're gonna do 3 auditory tests. We're gonna do a whisper test and a Weber's test and a Ryan's test, okay? So what I'm gonna do is I'm gonna include this ear, I'm gonna whisper something, and you tell me what I whispered, okay?
Apple.
Okay.
Baseball.
Okay, wonderful. Hearing is present in both ears. Next is the Weber's test. I'm going to strike this work and put it right here, and you're going to tell me if you hear it in both ears, okay?
Yeah.
Okay, great. And then I'm going to do the Ryan's test in each ear. Okay, ready? You're gonna put it right here, and then you're gonna hear it, and then you're gonna tell me when you stop hearing it, okay?
Okay. Okay, it's gone.
Okay. You should still hear it.
Okay, now I do hear it.
You do?
Yeah.
Okay, good. All right. Ready?
Now it's gone.
Okay.
Oh, it's not there. Now it's gone.
Okay, good. Hearing is present and there's no issues observed. So next I'm just looking at the external ear. I'm looking and palpating the external ear and your tragus. And then I'm doing the same over here. No discharge, or is it sensitive at all? Okay, good. Then I'm going to do an otoscopic examination. Okay. I'm visualizing the tympanic membrane, the cone of light, and the external canal. Okay, to the other ear. I'm visualizing the tympanic membrane, the external canal, and the cone of light, and associated landmarks. Okay, everything looks normal. Okay, so now we're going to go on to your lips. So your lips are nice and pink. Can you open up? Okay, I'm going to be looking at your buccal mucosa. Okay, go ah. Probably need my pen light for this. And then I'm looking at your salivary glands and your gums, and then I'm looking at, can you stick out your tongue? Okay. I'm going to be testing the strength of your tongue, so just push against. Okay. Push against. Okay. And then open up again. Okay, say ah. Okay, the uvula deviates when you say ah, and I'm looking at your soft palate, and your tonsils and your pharynx are all normal and non-inflamed, and your teeth look good. Okay, no cavities. Okay. All right, and then we're going to go on to your neck. So I'm going to be palpating 7 different lymph nodes. Okay. First thing I want to do is go forward. Okay, go back. Go side to side, and do a circular motion. Okay, great. I want you to shrug against me. Okay, and then push your jaw against my finger. There we go. Okay, great. All right, and so we're going to start with the pre-auricular. Here, we're going to take your glasses off. Okay. 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 Pre-auricular, we're going to go down to the submandibular. Okay. And then we're going to go do the submental, which is right under your chin. helping lymph node. And then we're going to go to your anterior cervical. And then your posterior cervical, which is behind your sternocleidomastoid bone. Your supraclavicular, which is on top of your clavicle on both sides. And then I'm just looking at your trachea placement. Okay, great. Okay. All right, and then next is your thyroid. So I'm just going to be inspecting it. Can you swallow? Okay, good. I'm going to be trying to find the cricord and finding your thyroid cartilage. Okay. Swallow. Okay, great. Thyroid is normal. Okay, there are no significant findings, and that concludes our video.
Thank you.